patients undergo IVF, one of the questions I hear most often is, how do you know which embryo is the best? Today we are going to demystify embryo quality, what it means, why it matters, and how we select the healthiest embryo for transfer in order to maximize the success rates of IVF. Coming to understand what is embryo quality. Embryo quality refers to how well an embryo is developing in the IVF lab. Not all embryos look or grow the same. Some divide consistently and reach the right stage at the right time, while others may develop more slowly. We assess quality using simple standardized grading systems that evaluate cell number, symmetry, and fragmentation. On the board, you can see examples of embryos graded from top quality to lower grades. Coming to understand what factors actually influence the embryo quality. There are several factors which can influence embryo quality. Maternal age is the most important variable. Eggs from younger patients tend to produce higher quality embryos when compared to eggs from older patients. Gamete quality, that is the egg and the sperm quality, influences the embryo quality to a great extent. Lab culture conditions like temperature, trigas levels and pH, which are carefully controlled to mimic the natural environment of fallopian tube, also influence the embryo developmental potential. Even the stimulation protocols which we use to collect eggs can impact the quality of embryos. Hence, all these steps are carefully designed to maximize the chances of producing high quality embryos. So, how do we select an embryo for transfer? After grading, embryologists select the embryo with best potential for implantation. This doesn't guarantee pregnancy, but it gives the patients the highest probability of success. We culture the embryos to blastocyst in most of the cases, which is a day 5 human embryo, which allows better assessment of developmental potential of the embryo. Here on whiteboard, you can see the timeline from fertilization to blastocyst with quality markers noted at each stage. So how do we reassure patients? It's important to remember that sometimes lower grade embryo can lead to a healthy pregnancy and a top grade embryo may fail to implant. IVF is about maximizing the probabilities and it's not about certainty. Educating the patients about this manages expectations and reduces anxiety. To conclude, embryo quality is a key part of IVF science. By carefully monitoring and selecting embryos, we use evidence-based approaches to give patients the best possible outcomes while keeping the process more transparent and understandable.